There are a lot of advances out there today that can help you look younger, feel more radiant, and to feel a lot more confident about how you show up in the world. Whether you're a man or a woman, it's important to feel your very best. Well, my guest today is Dr. Amy Miller. She is the owner of St. Louis Skin Solutions, and she's here to talk to us about all of the strategies that you can use that are non-invasive or minimally invasive to look beautiful at all times. Dr. Miller, thank you for being here.
Thanks for having me.
So, as a board-certified laser surgeon and an expert in anti-aging, what's possible today that maybe wasn't even possible 5 to 10 years ago?
It's amazing what's available. I tell my patients every day, I'm so glad I'm alive in this day and age because I have all these tools that our mothers never had or never could dream of having. But it's what you can do to preserve your youth, to preserve that person that you feel like you are on the inside so it reflects what you look like on the outside. You can do laser treatments to help resurface your skin, to help smooth it, help generate collagen and elastin in the dermis, help plump it up and smooth you out so that makeup goes on flawlessly. You can use that same type of laser to remove skin tags and all sorts of little lesions that you don't want hanging around. Just get those off of there. There's also lasers that target sun damage.
So you're talking about lasers, and for those of you who don't know what a laser is, can you just describe what is the laser and who's a good candidate for it?
Okay, so a laser in a very general term is a very focused beam of light. So when it's a true laser, it's one single wavelength of light at various different wavelengths, and some of the lasers that we use in dermatology are within the visible spectrum of light. I have one that I use for sunspots. It's a very pretty green color, but don't look directly into it. I've done it and you'll see spots. But many are not in the visible spectrum, so we can't see them. There's some that are infrared. But they all work by transferring that light to become heat when they hit their target in the skin. Most skin targets are either water or pigment. So pigment, we've got melanin for the brown spots and hemoglobin for the vessels. So anyone who has any of those issues that they'd like eliminated are good candidates for the laser.
Not only do you use lasers, but you also have therapies to treat acne and have services for wrinkle reduction.
Right.
So talk to us about when we have wrinkles or we have acne, how can we address those things?
Well, when you come in as a patient, I will sit down and consult with you and take a look at what the issue is, whether it's wrinkles or whether it's acne. And I am a medical doctor, so with that background, I look at the medical possibilities. But I also pull from my anti-aging and my laser background as well. So I like to think that we can offer a wide variety of things, and I'm not going to peg you in a certain box. Say you have acne, so you need antibiotics. Sure, they work for some patients, but not for all. So I like to think outside of the box.
A little more holistic.
Yes.
Where can we learn more about all the different services that you offer and find your practice?
Well, look on the web at www.stlouisskin.com or call us at 314-543-4015.
Whether you're a man or a woman, you may have questions about your appearance. How can I look my best? How can I make my skin look younger, fresher, and more radiant? Well, my guest today is Dr. Amy Miller. Amy, thank you for being here.
Thanks for having me, Kristen.
So what does it mean to really be fully radiant and beautiful in the world today?
Good question. It means different things to different people, but I think letting your true inner beauty shine forth and letting it come out so people can see your inner beauty, your inner confidence, and your self-esteem. And when people feel good about the way they look, they can do anything they want. I like to help patients put their best foot forward. There's so many things you can do, and at different stages of life, whether you're 20, whether you're 40 or 60 or 80, there's things that you can do to improve yourself, improve the way you look, and help you feel better about how you look.
So let's talk about acne. What can you do about acne?
Right.
It can be pretty embarrassing.
Yes, and acne affects so many people, and we always think of it as a teenage problem, but really it affects everyone across the spectrum of their life. Postmenopausal women get acne all the time, and they come in to me and they say, Dr. Miller, it's not fair. I got wrinkles and I got pimples. So do something. But acne is also affects your self-esteem, and I see that a lot in my teenage patients, because you get some kids who will have this nodular cystic acne, and that it can actually scar and affect them the rest of their life. So there are many ways to go about treating acne, and I combine the medical approach, once again with my family medicine background, but we also pull in different treatments, cutting edge technology, laser treatments. I like to use a little bit out of the box medication sometimes, but it's amazing what you can do for a patient when you can help them smooth their skin out and help them feel proud to face the world.
So before you came on the show, you were telling me this really heartwarming story about one of your patients who had acne and now they don't have it as severe.
And that's when you asked me why do I do what I do, I thought of this patient, and she's very sweet, Asian patient who immigrated to the United States and spoke several languages. And when she came in to see me, she had her hair long and her hair was down in front of her face, and she barely looked up at me through her hair. And she was so embarrassed because she had just disfiguring nodular cystic acne. She also had hirsutism, which is excess hair growth, which, as an aside, that's something called polycystic ovary disease, which we found out later. However, she told me she was working nights at Walmart because she didn't want to be seen by anyone. And it just broke my heart. And we got her acne cleared up, and it took probably 9 to 12 months. And when she came in, she had a short haircut, sassy haircut.
We could see her face.
We could see her face. She was wearing makeup, and she had a little bounce in her step. And then we were doing laser hair removal to get rid of the hair. And she just came in to see me a few months ago, and she's moving to Washington, D.C. She took a job with the government helping translate for other immigrants coming in from her country.
What a heartwarming story.
It is, and I think, you know, if she had stayed locked up behind all that acne at Walmart at nights, you know, her gifts wouldn't have been able to be spread to the world.
If you're like me, you loved the sun at some point in your life, and now years later, you're looking in the mirror and you're wondering, why did I love the sun so much? Let's face it, that you can have sun damage that shows up years later. Well, my guest today says that there is a solution for this sun damage so that you can make it less apparent on your face. Dr. Amy Miller, thank you so much for being here.
Thanks for having me.
So what do you have to say to all of us sun worshipers out there?
Well, stop. Don't do it anymore. But yes, I'm with you. When I was growing up in the 80s, and it was a healthy tan, which is an oxymoron, of course, because there's no such thing. But yeah, the tan does make you look good. It covers flaws on your skin, so I can see why it's so popular. But the problem with the tan is the damage doesn't show up until 20, 30 years later. So then you pay for it. So what can you do, right? Well, that's the ultimate question. Well, first of all, I tell people we need to get on a good skincare routine. I love to put something called Retin-A or tretinoin, which is a topical vitamin A, into their skincare routine. It's one of the few things that you can put on the surface of your skin that can penetrate into the dermis and directly stimulate fibroblast cells in the dermis to make collagen. And collagen is the key with our skin, because once we lose collagen, things start to sag, we start losing elasticity, the pores start to gape, and we just start looking old. So anything we can do to preserve that collagen is important.
So if someone is watching and they like to go out in the sun, or whether you don't like to go out in the sun, how much SPF should you wear on your face every day?
Well, I was taught in medical school that 15 is fine. However, I see so much damage day in and day out that I recommend 30 or higher. So once you get past about 50, you get up into that 70 range, it's really, you're paying a lot more and you're not getting that much more protection. So between 30 and 50 is what I generally recommend.
So if someone is going out, even if you're not going to the beach, is it still important to wear sunscreen?
Yes, if you're going to be out for more than 10 minutes a day out in the direct sun, I definitely would put sunscreen on and just make it part of your your normal routine. You brush your teeth, put your sunscreen on, and then put your makeup on. Just make it part of your steps that you go through every day so it becomes ingrained.
So if you didn't use that much sunscreen, if you find that you have some spots and some lines from sun damage, what are some of the things that you can do?
Well, there are some traditional things that have been done for years, and then there are the modern technology with the lasers, and that's really exciting. But most people like to start with the old stuff, and so there are prescription medicines that you can use. There's one that works particularly well that helps decrease the pigment production by the melanocytes. The melanocytes have been stimulated by that UV damage from years ago, so they remember that and they keep producing pigment. So you want to calm them down and relax them. So there's medications that help with that. My favorite thing to do is something called enhanced skin rejuvenation, is where we use 2 different lasers to eliminate sunspots and melasma type hyperpigmentation and telangiectasias and redness, all things that happen because of sun exposure.
So you are a board certified laser surgeon.
Yes.
And if someone wanted to come in and have that treatment done, where would they find you?
They can look online at www.stlouisskin.com or call us at 314-543-4015.
You may wonder, how do I get rid of those lines that are on top of my forehead or around my eyes? Well, many of you have heard about Botox, but how does Botox work, and is it the right solution for you? Well, coming up next in my Ask Your Doctor series, I'm here with Dr. Amy Miller. Dr. Miller, thank you for joining us.
Thanks for having me.
So we've heard about Botox.
Yes.
And then I've also heard about fillers.
Right.
So first of all, what is Botox and how does it work?
Okay, there is a lot of confusion out there between Botox and fillers. Botox is a neuromodulator. So what it does is it inhibits the nerve from telling the muscle to contract. So what does that have to do with lines? Well, the lines on our face often are dynamic lines, meaning they are from muscle contraction. So when you raise your brows to look quizzical or concentrating and trying to look stern, you contract muscles in your forehead.
Yeah, we've seen those lines where there's just like a line right here, or there's lines across here.
So what the Botox does is inhibits that muscle from contracting, and then the skin can literally heal itself. The skin stays smooth, and then the body starts laying collagen down in those lines, and they gradually get softer and fade away.
So when is the best time for someone who has lines to start to use this type of treatment, use Botox?
When they see a line at rest. When you're not contracting the muscle and there's a faint line there, that's the perfect time to start, because we can erase that line that's there and prevent it from getting any deeper. The longer you go, the deeper the lines get, the harder it is to get rid of them. And sometimes they get so deep that Botox doesn't take care of it, and then we have to bring in another tool out of the toolbox, something called filler or dermal fillers, where we actually replump the area.
I know that there are also lines that come around the face, that come down the side. Can you treat that with Botox?
Botox in general is not great for the lower half of the face. Now, there are some caveats to that. I like it for little perioral lines, little smoker lines around the mouth. But any of the nasolabial folds or any of this jaw area generally is not a great idea. So that's where filler comes into play. Generally with aging, we used to think that it was gravity. That gravity was pulling and everything was falling down. And that's true to a certain extent. But
the law of gravity has hit my face.
Yes, absolutely. But we now know that in addition to gravity, there's other forces at work, and we're losing volume, we're deflating. We lose volume in the skin and in the muscle and in the fatty tissue and even in the bone. When you look at an aged skeleton versus a younger skeleton, you can see that bone shrinkage. So really what the filler is doing is replacing that volume, where we're blowing the balloon back up. So it's giving you that youthful look that you used to have. I know there's docs out there who like to change people's looks with fillers. I don't like to do that. I just like to bring them back to what they used to have.
So is filler something that is permanently inside the face, or is it something that fades?
Most of the ones that are available on the market are ones that fade. The most popular are Restylane and Juvederm. Those last 6 months to a year. There's ones that last 1 to 3 years, and there's also a filler that's available that lasts 5 to 10 years. So you have your whole spectrum, and generally, if you want to put your toe in the water and try it out, I'll go with the 6-month one. But if you know you want some improvement and you don't want to have to come back, then I like to go to the 5 to 10 year one.
Do you have scars or warts or even things that are coming up on your body that you'd like to get rid of? I know that sounds a little crazy, but here on the Ask Your Doctor series, I have Dr. Amy Miller, who is an expert on this very topic. Dr. Miller, thank you for joining us.
Thanks for having me, Kristen.
So how do we get rid of that stuff? You know, all of a sudden it shows up one day, we find we have a wart, a skin tag, a scar, or just a patch of discolored skin. Is there any way to get rid of that?
It's so annoying, isn't it? Yes. Most docs will cut those off or freeze them off or do something to otherwise get rid of them. But with modern technology, we can now laser them off. And it's incredible how easy and fast it is. There's several different types of lasers that can do this. A laser that targets the water in the cells is what you're after, and you literally cook those right off the skin. It's a little pinchy, but a lot of times with the skin tags or warts or seborrheic keratosis, as the barnacles are called technically, will not have nerve endings. So it's easy and painless to get rid of them.
Now, I know that you are a board certified laser surgeon and you are the owner of St. Louis Skin Solutions. How long have lasers been around? And I know that they've also evolved in their use. So how long have they been around?
Lasers for medical use have been around for late 70s, early 80s is when they started to be developed. The dermatologic lasers really took off with the hair removal lasers. And for the longest time, the only hair removal laser that was available was one that was a very short wavelength that you could use only on very pale skin. As time has passed, they've refined and refined and refined, and now we have lasers that are safe to use on the darkest of all skin types. So there's been quite a journey, and who knows what's going to come in the future.
So what are some of the kinds of things that we can treat on our skin with a laser?
Well, we can do, my favorite thing is the anti-aging and treating the fine lines and wrinkles by resurfacing the skin. We peel off the epidermis. We use that heat from the laser to stimulate the collagen production in the dermis, and we can help smooth the skin and tighten the pores. But there's all sorts of skin tags and seborrheic keratosis and sun damage and sunspots that we can take off with the laser as well. We can even treat toenail fungus. Not that's something we want to think about, but it's revolutionary because the medicine for toenail fungus is you have to take it for months at a time, and it's awful on your liver. To be able to do 4 20-minute sessions 1 week apart and be done with it is amazing. So what the lasers offer us medically is fantastic. So
thinking about lasers, it sounds to me like in a lot of ways they're less invasive than full-out surgery.
Absolutely, you're right. We can take off things with a laser that you used to have to use a scalpel to take off. And the fact that you can do it as an outpatient without any anesthesia, with very little pain and downtime, really is gratifying for a lot of patients.
So if someone's watching and they have something that they'd like to take off of their skin and get out of their life, how can they find out more about using lasers?
Well, check us out on the web at www.stlouisskin.com or call us at 314-543-4015.
Dr. Amy Miller, thanks for being here as part of our Ask Your Doctor series.
Thank you.